How you folks doing? This prime scan is awesome for what I call study model impressions for appliances, you name it. I wear a Pantera, which helps me not to snore at night. I routinely take full arch impressions, study models with the prime scan, and it works so well. It's just routine. This video is about the technique that I use for that. Several little tips that I think will be important is remember that OptiGate works really well, so that keeps the lips out of play. The back end of this prime scan is used as a retractor for both the tongue and also the cheek, particularly when you get back to that second molar. This is pretty routine in my practice. I have found that it's so accurate, particularly the byte registration, the bilateral byte registration. The basic technique I use is I start in the premolar area and work it back to the molar, rotating out to the buccal to get that nice buccal corridor, bring that around on the lingual surface until I get the other side. This is on the upper arch, rotate it to the buccal, finish the buccal surfaces, the lingual, and I'm done. It doesn't take very long. Usually it's about a minute per arch, or if I'm having fun, if I need a lot of detail, I'll go back and just refine a few undercut areas where I really want to have that information. Same on the lower scan, directing it more toward the lingual, keeping that tongue out of the way, getting the occlusal lingual, coming back on the buccal, getting that buccal information, and then taking a buccal scan bilaterally, and that information is there forever. Well, as long as the patient's in your practice. I print the models when I need them. I'll send them off to a digital lab when I'm making an appliance. The appliances just drop in. Taking that buccal scan at the proper vertical you want for a removable appliance is really important because you'll find that it will pretty much fit in there for you, and there's minimal adjustments, particularly now that I'm using these nylon type of appliances. They have a little flexibility to them. They're really comfortable for the patient, whether it be a sleep appliance or a deprogrammer or some type of mouth splint for various purposes in our T&D theater. So let's go through the process of taking a full arch scan. It's pretty routine and I love it.
The OptiGate by Aviclar used the largest rim you can to fit to the patient's mouth. Don't overlube the lips. Tuck in that inner rim. This will provide excellent retraction. Lightly dry the teeth before you initiate the scan. I like to initiate the scan on the occlusal table, working toward the buccal corridors, using the back of the camera as a retractor. Move the camera on the occlusal table to the contralateral side, gaining the full arch, rotating to the buccal, using the back of the camera as a retractor. Complete the buccal and labial scan surfaces. Once the buccal scan and corridors are scanned, complete the lingual surfaces. If possible, extend beyond the distal of the last teeth in the arch. Check for any further data needs. Interproximally with recession. The prime scan works effectively to scan those interproximal undercuts. And we need that when we're making appliances that need retention. Dwelling the camera on the distal buccal where the cheek is in view will assure a good buccal surface of the tooth, and the cheek will evaporate with the final rendering of the model. The lower arch is initiated on the occlusal table, tipping to the lingual to gather that lingual information, bringing the camera around the occlusal table to the contralateral side, tipping the camera to the lingual using the back side of the camera as a tongue retractor. We have the full occlusal table. The full arch is now stabilized in the scan. Rotate the camera to the buccal, gathering the buccal corridors. Staying to the labial, gathering the lower anteriors. You can see the prime scan will just pick up that information so effectively. Finish out the buckle information. Try to get 3 to 4 millimeters beyond the soft tissue line. What's nice about the prime scan is it's really easy to go back and collect any information that you want to add. For the byte registration, if you want to CO for a study model, scan in the premolar and molar zone 3 to 4 millimeters beyond the CEJ. That will auto mount the upper and lower arch to the byte. Allow that to render and then scan the contralateral side, same area, premolar and molar with 3 to 4 millimeters of the soft tissue, and you now have a complete study model. If you want a byte registration for a appliance, find the vertical and jaw position desired for the appliance and take the byte registration right and left side in a similar way. And that is our full arch scan. It works every time, it's very proficient, and it's really precise and reliable.